Guys, you finish your tests now, and what we'll do is we'll grade them in a minute. During the lecture, you're sort of going to get the answers from them, and of course, if you have questions later, you can ask them. The quizzes are not going to count against you. They're only going to help you. And so you guys don't worry about the quizzes. You'll keep them in the back of your manuals you were given, and you'll review them. But don't try to memorize answers, because these answers will not be on the final. The final is going to be all of the quizzes in every session we go over, and you will look at the form of the question, and then you will go ahead and answer in the categories so that you know, like arterial, venous, lymphatic, neurologic, whatever's causing the disease that someone may have, like diabetes, for instance. And you're going to go ahead and also use your colored pens to label these. But for right now, we're going to start out by taking your right thumb and rubbing it over the left forearm. Rub it briskly and press down hard. Now, after a few seconds, go ahead, everybody, rub. You're going to notice that this is heated up a little bit and it's turned red. Now I want you to take that thumb and press down very hard on the area you were just rubbing. Now you're going to release, and you'll notice that the red area has become white and now has returned. So that's blanching, as you all know. And when something blanches and then returns to the normal circulation, that's fine. But in patients, and you know this, doctor, from patients that you've seen that are post-op, or patients that are convalescing, or post-CVA, and you know this from a physical therapy point of view, that these patients that can't move themselves wind up with friction injuries, or where your thigh and your buttocks may be in bed, are stuck to the bed, and you rock forward. Now go ahead and rock forward and feel your spine, that is your skeleton, moving forward on the skin. And that pressure is directed downward. Those are the two main causes for pressure ulcer development. Shear, which is the rocking forward, and friction, which we demonstrated on the forearm. Also, when you pushed and it blanched, in a stage 1 pressure ulcer or pressure formation, you actually won't see broken skin, but you will see the redness. When you press down, it stays red, so it's non-blanching. Now, when we take the aspects of wound care and we're looking at them in our manuals, the things that you're going to do to help you study, and believe me, you can use your own study method. We're just going to suggest some things to you guys, okay? We're going to use these colored pencils that you got. So what I want you to do is I want you to turn to the first page, take out your green pencil, look for neuropathy, and you're going to underline it. And that gives you the signal that nerves will now, all nervous related diseases, neuropathy being, diabetic neuropathy being a big one, are going to be underlined in green, okay? Red, of course, for arterial diseases, blues for venous type diseases, and any other ones we come to miscellaneous. We'll get to those colors. But when you're reading this manual, you will use your 3x5 cards we're going to give you when you leave to make notes. You'll use your color-coded pencils, and you're going to follow along in the story. And after all of the sessions are over, you will have a good color-coded diagram in your mind, in your book, to help you organize into the disease states, the major disease states, the major problems. Are there any questions?
No.
Any questions?